Now I want to introduce our student speaker, Scott Boisvert. Scott is a Robertson Scholar who's paired his global health major with biology, but he's also our first student to write a double honors thesis in 2 majors. Yes, he did that. It's amazing. Scott developed a passion for global health during his first semester at Duke when he took DGHI's Vulnerable Populations in Global Health course. Subsequently, he completed fieldwork in Cambodia and later in Sri Lanka. Next year, as a Hart Fellow, Scott will spend 9 months in Bulgaria researching multi-drug-resistant tuberculosis among the Roma, whose increased vulnerability in Europe has created multiple health disparities. In the future, he plans to earn an MD, and he believes that his experience as a global health major at Duke will have equipped him with the tools he needs to be an effective, competent, and globally minded physician. We're honored to have him speak to you now, representing the class of 2015. Scott.
Behind it from you.
There we go.
This is a little hazing ritual that we do each year with our student speakers.
All right, now that I have my speech, college is a time of reflection, of sorting through your past to figure out who you are today. College is a time of development, of laying the foundation for who you want to become both professionally and individually. College is a time of solidarity, of engaging with your peers as you work collectively to improve the world around you. But most of all, college is a time of opportunity, and there is no better place for opportunities than here at Duke, at the Duke Global Health Institute. It's an exciting time to be working in global health. Around the country, around the world, there is an increasing focus on global health. Even here at Duke, we are celebrating just our 3rd graduating class. When we entered as freshmen, some of us started our paths in focus, or working towards the Global Health Certificate, or still others working towards a program too. Now we have a full global health undergraduate major, and the number of declared majors in the department has increased to over 300. We have been part of an exciting time for the global health department's expansion, and now it's our turn. As new graduates in global health, we have the challenge to shape this growing field, the opportunity to impact populations in need in meaningful ways, and the call to develop ourselves both professionally and personally in a field of service. But we are ready for it. Just look at the capstone class as evidence of that. Small, individualized classes with highly involved faculty and staff, working collaboratively to produce meaningful real-world projects, all being implemented in only a semester's worth of time. My team, consisting of my friends Sonia and Laura and I, we collected surveys of patients impacted by hepatitis C in Egypt. From this, we were able to create informative patient pamphlets and recommend structural changes for the affiliated hospital and supporting nonprofit organization in Alexandria, Egypt. Still another group focused on improving knowledge about available medical care for migrant farm workers, and another combated LGBTQ stereotypes in local North Carolina schools. These experiences are all vastly different in topic and in implementation, yet the common thread of each of them, as well as the other similar projects performed by everyone, is that they are highly impactful on the communities that they serve. While the development of a professional field provides career opportunities, it similarly stimulates personal growth. Global health is defined by this interplay between working for others and working on yourself. The experiential learning component of the major, which entails completing an 8-week field experience that we heard about a little bit earlier, is one of the unique ways that global health here at Duke fosters this growth. In fact, if I had to pick one aspect of my time here at Duke that was instrumental to defining who I am today, it would be the experiential learning component of the major. In talking with my classmates, this view is a common one. For many, this is because the field experience requires traveling and stepping outside of personal comfort zones. For some, it compels a new cultural awakening. And for everyone, it demands immersing yourself in a new community in order to understand their needs and their interests as your own. Some of the amazing fieldwork my fellow classmates have accomplished include working with flu preparedness in Nepal like Anastasia, or like Anusha doing alternative medicine research in Togo. I completed my experiential learning component by spending the summer in Battambang, Cambodia, where I worked as an aide in a health clinic and also taught local kids important health concepts through a weekly after-school club. This was the first time I had traveled outside of North America, and the people I met, the culture that I lived in, was unlike anything I had ever experienced. Thinking back on it now, that's what really stands out. Not only learning about the implementation of global health projects outside of the classroom, but remembering the people that I met and worked with, the relationships that I fostered, the personal boundaries that I pushed. And all of this is similar to the experiences shared by everyone here today. We all grew so much from our experiences in and out of the classroom here at Duke, and that is because for the global health major, learning by doing is the foundation of the curriculum. I'd be remiss to talk this whole time about student experiences without mentioning the amazing global health faculty that I've had the privilege of working with for the past 4 years. We have all had tremendous support and mentorship for selecting courses, arranging summer experiences, and making post-graduation plans. I had additional advising for conducting a thesis in the major and was able to work as a TA and student representative with Dr. Boyd, planning the curriculum for the newly designed Global Health 101 class. This level of interaction and support is not the exception. It is the norm for global health and truly a benchmark for the rest of the university to strive for. On this day of bittersweet memories and hopes for the future, there's at least one thing that I know all of us here can do. We can stop, look back on all that we've learned and accomplished, and know that we have done something that is important, and moreover, that we are well prepared to continue to achieve at these highest levels of excellence. That we will forever be learning more about ourselves and the needs of the world around us, wherever our careers may lead. And we can thank the Global Health Department for their role in our development. Best of luck to everyone, and congratulations to the class of 2015.